Preventing ovulation. C. Correct answer.
Contraceptive and pills help in birth control by preventing ovulation.
Most important components of oral contraceptive agent is A. L. Correct answer. Birth control pills. Oral contraceptives check ovulation in female by inhibiting the secretion of FSH and LH that are necessary for ovulation. It contains small doses of either progesterone alone or a combination of progesterone and estrogen combined pill. So, the correct answer is progesterone. Chronic gonadotrophin is secreted by A. Correct answer. Human chorionic gonadotropin (HCG), or human chorionic gonadotrophin, is a placental hormone initially secreted by cells syncytiotrophoblasts from the implanting conceptus during week 2, supporting the ovarian corpus luteum, which in turn supports the endometrial lining and therefore maintains pregnancy. Causative organism of syphilis is A. Vibrio, B. E. coli, C. Mycobacterium, D. Treponema pallidum. No. Correct answer is D. Treponema pallidum is a spirochete bacterium with various subspecies that cause the diseases syphilis, Bajel, and yaws. It is chiefly transmitted amongst humans, but it can also cause a condition found in cattle, bovine digital dermatitis. APGAR score is 9 means baby conduition is A. Good. B. Correct answer. Which sign is severe dehydration? A. Sunken fontanel. B. Skin turgor. C. Correct answer. Which vaccine store in freezing compartment? A. DPT. No. Correct answer is D. The commonly administered measles, mumps, rubella MMR vaccine can be stored either frozen or refrigerated, while the MMRV vaccine that also contains the live varicella virus must be frozen. Normally by 1 year of age the birth weight of an infant should increase by A. 3 times. Correct answer. From birth to 6 months, the typical baby will double their birth weight. From birth to 1 year, they will triple their birth weight. The first stool of neonate is called. Correct answer. The first stool of neonate is called A. Meconium. B. Correct answer. Cyanosis in a child can be seen in all the places mentioned below except A. Nails, beds. B. Tongue. C. Lips. D. Sclera. Correct answer. Molly, with suspected rheumatic fever, is admitted to the pediatric unit. When obtaining the child an RS-Quo-S history, the nurse considers which information to be most important. A. Vomiting for 2 days. B. A recent episode of pharyngitis. Correct answer. A recent episode of pharyngitis is the most important factor in establishing the diagnosis of rheumatic fever. Although the child may have a history of fever or vomiting or lack interest in food, these findings are not specific to rheumatic fever. Nurse Annalisa is administering a medication via the intraosseous route to a child. Intraosseous drug administration is typically used when a child is A. Over age 3. B. Critically ill and under age 3. Correct answer. In an emergency, intraosseous drug administration is typically used when a child is critically ill and under age 3. While examining a 2-year-old child, the nurse in charge sees that the anterior fontanelle is open. The nurse should ask. Correct answer. Because the anterior fontanelle normally closes between ages 12 and 18 months, the nurse should notify the doctor promptly of this finding. An open fontanelle does not indicate abuse and is not associated with Tay-Sachs disease. The nurse is aware that the most common assessment finding in a child with ulcerative colitis is A. Correct answer. Ulcerative colitis causes profuse diarrhea, intense abdominal cramps, anal fissures, and abdominal distensions are more common in Crohn's disease. When administering an IM injection to an infant, the nurse in charge should use which site? Correct answer. The recommended injection site for an infant is the vastus lateralis or rectus femoris muscles. The deltoid is inappropriate. The dorsogluteal and ventrogluteal sites can be used only in toddlers who have been walking for about 1 year. A child with a poor nutritional status and weight loss is at risk for a negative nitrogen balance. To help diagnose this problem, the nurse in charge anticipates that the doctor will order which laboratory test. A. Hemoglobin. B. Total protein. C. Correct answer. A negative nitrogen balance may result from inadequate protein intake and is best detected by measuring the total protein level. Measuring total iron binding capacity, hemoglobin, and serum transferrin levels would help detect iron deficiency anemia, not a negative nitrogen balance. When developing a plan of care for a male adolescent, the nurse considers the child and RS-QoS psychosocial needs. During adolescence, psychosocial development focuses on A. Becoming industrious. B. Establishing an identity. Correct answer. According to Erickson, the primary psychosocial task during adolescence is to establish a personal identity confusion. The adolescent attempts to establish a group identity by seeking acceptance and approval from peers, and strives to attain a personal identity by becoming more independent from the family. Becoming industrious is the developmental task of the school-age child, achieving intimacy is the task of the young adult, and developing initiative is the task of the preschooler. When developing a plan care for a hospitalized child, Nurse Micah knows that children in which age group are most likely to view illness as a punishment for misdeeds. A. Infancy. B. Preschool age. Correct answer. Preschool age children are most likely to view illness as a punishment for misdeeds. Separation anxiety, although seen in all age group, is most common in older infants. Fear of death is typical of older school-age children and adolescents. Adolescents also fear mutilation. Nurse Sunshine suspects that a child, age 4, is being neglected physically. To best assess the child and RS-QoS nutritional status, the nurse should ask the parents which question. An LD-QO, has your child always been so thin? And RD-QO, an LD-QO, is your child a picky eater? And RD-QO, an LD-QO, what did your child eat for breakfast? And RD-QO, an LD-QO, do you think your child eats enough? And RD-QO. Question 10 explanation. The nurse should obtain objective information about the child and RS-QoS nutritional intake, such as by asking about what the child ate for a specific meal. The other options ask for subjective replies that would be open to interpretation. An LD-QO, has your child always been so thin? And RD-QO. B. An LD-QO, do you think your child eats enough? And RD-QO. C. An LD-QO, what did your child eat for breakfast? Correct answer. The nurse should obtain objective information about the child's nutritional intake, such as by asking about what the child ate for a specific meal. The other options ask for subjective replies that would be open to interpretation.